Okay, the very last section of the facial bones along with the skull is your orbit. So we're going to cover the orbit. Along the top, I want you to look at the roof, the medial wall, the floor, and the lateral wall. So we're looking here, this little notch is your supraorbital foramen. You have your orbital plate of your ethmoid bone, your lacrimal bone with your lacrimal groove. Your nasal bone is up top higher. We have your optic canal with your optic strut, your infraorbital groove there, your maxilla, and your infraorbital foramen. So there's a supraorbital and an infraorbital foramen. You have your superior orbital fissure here, and this is your inferior orbital fissure down below. So you have your optic canal, which is round, your supraorbital fissure, think of super up top, and then you have your infraorbital fissure down below, your zygoma, your greater wing of your sphenoid, and your lacrimal fossa. Yes, your lacrimal gland fits in your lacrimal fossa of your orbital plate of your frontal bone. So when we look at the 3D, the CT 3D, the main thing I want you to see here is the orbital plate of the frontal bone, which is also your roof of your orbit. This is your lateral wall, your floor of your orbit, and your medial wall. I think looking at a 3D CT, it's hard to see exactly what the bones are in the inner orbit, so I would not ask you on a CT 3D to label the orbital bones. So we've seen this one before. You have your frontal sinus up top, your orbital plate of your ethmoid bone. This is your palatine bone, your sphenoid bone with your sella turcica back behind, your pterygoid plate of your sphenoid. This is your maxillary process of your maxilla with your maxillary sinus, your canthion or anterior nasal spine, either way. Your infraorbital canal here, yes, blood vessels, nerves come through here. Frontal process of your maxilla with your lacrimal groove on your lacrimal bone. You have your nasal bones here, and this is your orbital plate of your frontal bone. Here's a CT. This is an axial CT. Nasal bones up top, followed just below. You can see a little line in there. That is your suture for your frontal process of your maxillary. So your globe is your eye, globe. You have just behind your, so it goes nasal bones, frontal process of your maxillary to your lacrimal bone to your ethmoid bone. So those are the bones heading posteriorly. You have your greater wing of your sphenoid with your zygoma coming around. This is the body of your sphenoid. This is your dorsum sella. The thing I wanted to point out here is your supraorbital fissure. So remember seeing that on the coronal slice, and your optic canal. Optic canal. You can guess what runs through there. So looking here, this is a coronal slice of CT. We have your lesser wing coming across the top. So your temporal bone, your sphenoid sinus, your optic canal is here, your greater wing of your sphenoid, maxillary sinuses, your inferior nasal concha, and your middle nasal concha, and your superior nasal concha, which you don't see often, so that's a great image of it. Your inferior orbital fissure is here, so supraorbital fissure, inferior orbital fissure, and this is your optic canal coming up top. Important to be able to distinguish between those. And of course, like I said, the lesser wing coming across the top of your sphenoid bone. So this is another picture. So you have your nasal bones, you see that suture there, and then you have your maxilla and frontal process of your maxilla with your lacrimal, your ethmoid. So if we're heading back, this is your inferior orbital fissure, your zygoma. This would be your greater wing of your sphenoid. So these are anterior, middle, and posterior ethmoid sinuses with your sphenoid sinus posteriorly. So the muscles of the eye, the way that it works here. So we have medially your lacrimal sac, and it's in your lacrimal groove. So your anterior compartment of your globe, you have your lens, then you have your posterior compartment of your globe. Coming around, you have your lateral rectus muscle, lateral rectus. Your optic nerve comes straight back through your optic canal. So this is your optic nerve, and this is your medial rectus muscle. So you have your lateral rectus muscle, your optic nerve, and your optic canal, your medial rectus muscle, and your lacrimal sac. And then you can see here the wall of the nasal bones. So here's your lacrimal sac. Hard to see. This is MRI T1. So fat is bright here and fluid is dark. So if this was a T2, the globes would be glowing bright white. So you can see the lens there. You have your lateral rectus muscle, your optic nerve, and your medial rectus muscle. So coming over, you have your lateral rectus muscle, optic nerve, and your medial rectus muscle. You have your anterior chamber, posterior chamber, separated by your lens. All right, so this is CT, and you can see your lacrimal sac nicely with your globe, and here's your optic nerve. Coming around, here's your lateral rectus muscle, your optic nerve, and your optic canal coming back, and your medial rectus muscle, and your lens has the density to it, and that's your posterior chamber of your globe. So the one thing I want to show you on this slide is this right here. This is your superior ophthalmic vein right there. So that one you're going to see because it's suspended in fat. So it'll have your lateral rectus muscle, your optic nerve, but superior to the optic nerve is going to be your superior ophthalmic vein, and then your medial rectus muscle. This is MRI T1, and you can see your superior ophthalmic vein coming around. So suspended in the fat, because the fat is nice and bright, so you can see that vein really well. Here's another great shot of it on CT. You can see it very well there, superior ophthalmic vein, and then your lacrimal gland. See how the orbit looks distorted? And it looks like a little bit of a different of a density between the globe and the piece lateral, so you can see it well over here. So that's your lacrimal gland. Here's the coronal diagram here. We've got the superior levator muscle, and we have your lacrimal gland there. I want you to know your lacrimal sac is in your lacrimal groove coming down your nasal lacrimal duct. It's hard to see. We'll catch it once in a while. When I have it on the images for you to label, I'll point it out so that you know exactly what that is. Okay, moving forward. So this is a CT, and you can see part of the duct coming down right there. That's the main thing. You should be able to label everything else on there. Here's a sagittal view of the orbit. So your superior levator muscle, then you have your superior rectus muscle. This right here is retroorbital fat. It's the bright white on MRI T1. Here's your optic nerve and your inferior rectus muscle. Now you have an oblique muscle. You have an inferior oblique muscle and a superior oblique muscle. Here is where your inferior oblique muscle is. This is your globe. The whole thing is the globe, the posterior chamber, the lens, and the anterior compartment or anterior chamber. Here's a sagittal T1, so you can see the fat is nice and bright. You have your superior rectus muscle, your optic nerve with your inferior rectus muscle, and that little gray slash right there, that is your inferior oblique muscle. Here's a coronal. So you can see if we start with your superior rectus muscle, and you have your superior levator muscle just above it. So you have your superior levator, superior rectus coming around. You have your superior ophthalmic vein with your artery just below it and your optic nerve. So the artery usually runs right along with the optic nerve, and your vein is suspended in the fat. Your lateral rectus muscle, your inferior rectus muscle, your medial rectus muscle, and here's your superior oblique muscle. They should have put the inferior down over here, but they didn't. That does the turning of the eye. So CT, you can see this is your ethmoid sinuses, your superior oblique. Now it's hard to tell the difference between each of the muscles. If you label this superior rectus, lateral rectus, medial or inferior rectus and medial rectus, and then your optic nerve right down the middle, I would mark you correct. You cannot see the differences within the muscles. MRI is a little bit easier because it's suspended in the fat, which is bright white, so it makes it a little easier. You have your superior rectus Superior ophthalmic vein, hard to see. I wouldn't ask you to label that on this. I do it on an axial slice. So here's your lateral rectus, your optic nerve down the middle, inferior rectus, medial rectus, and your superior oblique is there. Your artery is kind of suspended in the fat there. You can see a piece of it. This is CT, coronal, so superior rectus. This is, I would just call this your medial rectus muscle, inferior rectus muscle, and you can see your lacrimal gland here and on the other side here, with just on the outside of the globe. All right, so that's it for your orbit, and that sums up your skull and facial bones lectures. Make sure you review these so you're ready for lab. I will have CT and MRI images hung so that you can label real images. You'll want to print off the lab and bring it with you. All right, good luck.